Imagine going to a country where you didn't speak the language. You're thousands of miles away from home. People can't understand you. You can't talk to them. Then imagine you get hurt or get sick. You go to a local medical facility and the doctors can't understand you. You don't know how to tell them what's wrong with you.
Before we had Indigenous interpreters, it was very intimidating and very scary to take care of these patients. I wasn't able to communicate well when the patient first come in. It's very unrewarding because they don't really understand that we're there to help them. They didn't trust us.
The philanthropic support has allowed us to be innovative in the field of interpretation and communication. It permitted us to deliver one of the first interpreter training tailored to individuals that speak Indigenous languages or languages of lesser diffusion.
Some of these languages are 4,000 years old, pre-colonial. Nobody can understand them. And we had a real need here at Natividad.
Kupi bakas kwentando tratando sendo ini ambulancia. Cinti kundo imakinando nya kundanin tu si alo sendo nya awa kanditani malo.
Speaking to a Zapoteco interpreter, we discussed tuberculosis, and interestingly, they described it as a devil strangling them, which helps us understand how to communicate to our Indigenous-speaking patients. To them, tuberculosis feels like the devil is strangling their neck.
As soon as we began to provide interpretation, we started to receive calls from all over the country. And we realized that this was not just a local need, but was a regional and a national need.
Now that situation doesn't even happen. It's been amazing for us. It's been very rewarding to take care of these patients as we've been able to prepare them and talk to them and understand where they're coming from culturally.
Not only are we adapting a training to be able to address the unique challenges that Indigenous interpreters face, as well as giving them all of the information that any professional interpreter would need, but we will also be testing and providing programs that create that proficiency testing.
We've been able to then increase our roster from about 4 interpreters to now 200 in our network.
Our ability to provide a higher level of quality of care is greatly enhanced. It's great for the patients and it's rewarding for the doctors.
My vision for Indigenous Interpreting Plus is to be able to provide a means of training, work experience for individuals that speak Indigenous languages.
Indigenous Interpreting Plus was the realization that in order to provide language access to these patients, you were actually going to have to provide jobs to the interpreters themselves. And that started us on a journey that is very unexpected and has taken us in many unexpected directions, but in the end we have this wonderful service where now multiple languages are being offered with trained interpreters, and we're really excited about it.